can you hit white balance again when you get a chance? Okay, we're just getting started on the right shoulder. We're looking in from the back to the front. Everything's magnified a bunch on the screen. Go ahead. One more time. And we're just getting our first look inside the joint here. And we'll start in the front. So this is the biceps tendon on the left here. And as we look down, this anchor looks okay, a little bit loose, but it's not really completely detached. I think that's okay for now. One of the things that we can see here is your rotator cuff is torn. So you've got this undersurface tear of your rotator cuff. And we may have to do something with that. We're going to put a shaver in right now and just clean up the edges so we can make a better assessment here. So it looks to be partial thickness. We'll likely do some sort of partial repair there. Okay, and now as we look towards the back of the shoulder, I don't really see any tearing in the posterior labrum of any significance. Here's the posterior capsule. We often see an injury called a Hill-Sachs lesion, where there's been some damage to the humeral head. And you don't really have a significant one. As we look down the front of the shoulder, we can see this injury here where you've got this labral detachment here. This is the Bankart injury right here. And we can kind of get a look at this. We'll get a better look when we look from the front. So we're going to be fixing that for sure. The real decision is whether or not we do a remplissage versus just some suture anchors in the glenoid in the back. So I'm going to look at this a little more and decide in just a minute. Okay, so this is the area in the back of the shoulder where we're going to place a couple suture anchors and do what's called a remplissage procedure. You can see there's a little bit of exposed bone. We actually took off a little bit more cartilage just to have a good place for healing and to place our anchors. And again, we're looking in the back of the shoulder here. Okay, so we've got our first anchor in, and you can see how we've divided the sutures. One's coming out the front right there, one's coming out the back. We're going to go ahead and pass a stitch and then do a second one in just a minute. Okay, here's the second Q-fix anchor. You can see when I tug on it, it's very solid. You can see how when I pull on it, it's going to bring the humeral head back, or alternatively bring the capsule up and tighten it down. So we're going to go ahead and get these organized in just a minute. Okay, so now we've got both mattress sutures passed. You can see how the second suture, we're going to close up the posterior portal. Can we turn that off, please? We're going to close up the posterior portal once we tie that. We tie all these at the end. And so now we're going to get to work in the front of the shoulder. This is where we've got some work to do as well. That's the Bankart injury right there. I'm going to show you with my grasp as we get ready to put some anchors in the front. So this is the area right here that we're concerned about. Now, just gently bring the arm back towards you. Just up and back if you can, just gently, yeah. Okay, pause. Okay, we're just using this instrument just to roughen up the capsule. We want to make it stick together and heal like a piece of Velcro, basically. So we don't want to remove any tissue, but we want to roughen up this anterior band of the inferior glenohumeral ligament all the way down to the inferior recess to the inferior pouch here, and that's what we're doing. Okay, I'll show you some more in a little bit. Okay, you can see our suture hook. We're going to start here. We're going to rotate back. Let me show you some more. That hook's going to come out right about there. You can see it. Okay, so we're going to take that. Okay, so we've got the anterior shoulder reconstructed. We placed 3 anchors in, and we've got it repaired all the way up to the rotator interval. You can see kind of the leading edge of the subscapularis tendon right there. And we obviously don't want to include that in the repair. So I'm happy with that. It's hard to see down there, which is a good sign. We have not tied the Remplissage sutures yet. That's going to be next on our list of things to get done right now. Hold that for me. Okay, so we've passed kind of a ripstop stitch and another stitch to seal off that rotator cuff. And we're going to tie that in the subacromial space after we tie the Remplissage sutures. We still haven't done that yet, but I just wanted to show you how we configure those sutures. We may even put one more in. Okay, we're looking up where that Remplissage was done. That little tear there, that's where the cannula came through the portal. That heals on its own. But the more important thing is we've got that capsule connected. You can't see the sutures anymore because they're tied and everything's very snug as we rotate. So I'm very happy with the way that looks, all the way up to the top here. So we're going to finish inside the joint. We've still got to go tie those rotator cuff sutures in just a minute. Okay, so we've tied our 2 sutures for the cuff repair. Remember, we did a ripstop and then another one to bring it from medial to lateral, which is that stitch there. The ripstop stitch is just below it. So we're going to finish up here. The rest of the cuff looks great. There's no problems on this bursal side. So we are going to get you back to the recovery room shortly, and hopefully this will do the trick for you, okay? So good luck to you now. Bye-bye.